Hello, my name is Dr. Clasherrol Edwards. I'm a clinical research coordinator at Meharry Medical College, and today I'll be talking about implementation of the Family History and Cancer Risk Study, otherwise known as FOREST, at an HBCU, specifically Meharry Medical College. And this is a collaboration between Meharry Medical College, Vanderbilt University Medical Center, and Duke University. Purpose. The FOREST team wants to do two things: build a better way for people, doctors, and medical clinics to gather family health history and tell people at increased risk for inherited cancer syndromes if they may need special cancer tests. FOREST workflow. Our study uses a software developed by Duke University called MeTree, a patient-facing web-based platform that assesses family health history cancer risk and allows a patient to build family health history before a visit. The patient enters family history on MeTree. They are told if they have risk based on family history. A pedigree can be placed in the EHR. High-risk participants are directed to optional genetic counseling services, and the genetic counselor can order genetic testing. Methods and results. We conducted 2 community engagement studios to advise our study design. We collaborated with Meharry Community Engagement Corps with 12 minority community members from North Nashville, Tennessee. Community questions, concerns, and suggestions included medical data privacy concerns, potential benefits versus risk of the study, and proper informed consent of patients and families. Based on the community engagement studios, we developed these 3 recruitment methods: a passive approach using pamphlets placed inside Meharry Family and Community Medicine Clinic waiting room. This is a small clinic that gets about 5,000 visits a year. Then an active in-person approach with a clinical research coordinator staff table outside of Meharry Family and Community Medicine Clinic. And then a hybrid approach using QR code linked flyers in lobbies and elevators where interest and contact form information was received by the clinical research coordinator. Using the in-person recruitment method, 60 patients were approached in person. 14 of those patients were interested in the study. 9 of those patients went on to complete eligibility. 6 completed the consent and pre-family health history questions, and 2 of those patients completed the MeTree tool, giving us a 14% overall completion rate. In the QR to CRC arm, 5 patients showed interest. 4 completed the eligibility survey. 3 went on to complete consent and the pre-family health history questions, and 2 of those completed the MeTree tool, giving us a 40% overall completion rate for the QR to CRC arm. And 2 patients were brought into this study from patient referral, and those 2 patients completed the entire study, giving us a 100% completion rate based off patient referrals. Conclusion and next steps. Our overall enrollment rate was 31%. Our overall completion rate was 28%. When stratified for in-person and QR to CRC enrollment methods, the in-person method had a 14% completion rate, and the QR to CRC had a 57% completion rate. These numbers are small, so they have not reached statistical significance, but we do expect this trend to continue as we move forward. We also offer in-person assistance at any point during the study, and we had 14% of our patients utilize in-person assistance, and of note, those patients were all from the in-person enrollment arm. And our next steps are to expand our recruitment. We will use the Meharry Study Interest Registry, which has 150 patients that are interested in participating in Meharry studies, and also expand to include the Meharry Internal Medicine Clinic, which has a higher volume of about 20,000 visits a year. We acknowledge our collaborators on this project. This grant was funded by the NIH and by the National Cancer Institute with Vanderbilt University Medical Center and the National Institute of Minority Health and Health Disparities for Meharry Medical College.